Welcome to Lesson 9, Unit 15, Blood. This detailed medical English lesson uses slow English narration. The original page remains on the left, and the yellow highlight marks the exact sentence or item we are studying. On the right, the English wording, a full Arabic translation, and a short Arabic language note appear on screen. I will speak English only. Begin with Section A, Full Blood Count. In the investigation of blood diseases, one of the simplest tests is a full blood count, also called FBC. A full blood count measures several things in a sample of blood. First, it measures the amount of hemoglobin. Hemoglobin is the substance in red blood cells that carries oxygen. Next, it measures the number of different blood cells. Red blood cells, also called erythrocytes, white blood cells, also called leukocytes, and platelets, also called thrombocytes. Red blood cells carry oxygen. White blood cells help defend the body against infection. Platelets help the blood clot. The test also measures the volume of the cells. Finally, it measures the erythrocyte sedimentation rate, or ESR. This is a measurement of how quickly red blood cells fall to the bottom of a sample of blood. Read the Arabic translation of every item on screen, and notice the difference between the familiar cell name and the formal medical name. Section B is anemia. Anemia is one of the commonest diseases of the blood. The page gives 3 important possible causes. The first is bleeding, which means loss of blood. The second is excessive destruction of red cells. Excessive means more than normal. The third is low production of red cells. This can happen, for example, when the diet is lacking in iron or deficient in iron. Iron is important for making hemoglobin. Now read the first part of the conversation. A medical student has examined an elderly patient with a very low level of hemoglobin. The professor asks, what is the most likely diagnosis in this case? This question means, what is the diagnosis that is most probable? The student answers, most probably carcinoma of the bowel with chronic blood loss. Carcinoma means cancer. Bowel means intestine. Chronic blood loss means blood loss continuing for a long time. The professor then asks, what is against that as a diagnosis? Here, against means evidence that does not support the diagnosis. The student explains that the patient has not had a change in bowel habit and has not lost weight. Both of these findings make bowel cancer less likely. Read the English question and its Arabic translation on screen before we continue. The professor next asks, what else would you include in the differential diagnosis of severe anemia in a man of this age? Differential diagnosis means a list of possible diseases that could explain the patient's problem. The student says that the patient might have leukemia of some sort, or aplastic anemia, but these are rare or very unusual. Leukemia is cancer of blood-forming tissue. Aplastic anemia is a condition in which the bone marrow does not produce enough blood cells. The student also mentions iron deficiency because the patient seems to have an adequate diet. Adequate means enough or sufficient. The professor then suggests another, more likely cause. The student asks, chronic bleeding ulcer? A chronic bleeding ulcer is an ulcer that loses blood over a long period. The professor agrees, but asks, what about pernicious anemia? Can you exclude that? To exclude a diagnosis means to decide that it is not the cause. The student says that the patient has none of the typical neurological symptoms, such as paresthesia. Paresthesia is an unusual sensation, such as tingling, pins and needles, or numbness. Notice the useful language in this conversation. Likely and unlikely, for and against a diagnosis, common and rare, and adequate and inadequate.
Every question is translated into Arabic on screen while it is being read.
Now look at Section C, Pernicious anemia. Pernicious anemia, or PA, is a condition in which there is atrophy of the gastric mucosa. Atrophy means that tissue becomes smaller or weaker. Gastric mucosa is the lining of the stomach. The condition causes failure of intrinsic factor production and vitamin B12 malabsorption. Intrinsic factor is needed for the body to absorb vitamin B12. Malabsorption means that the body does not absorb a substance properly. The onset is insidious, with progressively increasing symptoms of anemia. Onset means beginning. Insidious means slowly developing and not immediately obvious. Progressively increasing means gradually becoming more severe. Patients may have a lemon yellow color because of a combination of pallor and mild jaundice. Pallor means lack of color, often looking pale. Mild means slight. Jaundice is a yellow color caused by bilirubinemia. The textbook explains that jaundice may result from excessive breakdown of hemoglobin because red cells are produced ineffectively in the bone marrow. Breakdown means division into smaller parts. Bone marrow is soft tissue in the cavity of bones where blood cells are made. Keep the page and Arabic translation in view while the explanation is read. Continue with the clinical features of pernicious anemia. A red tongue, also called glossitis, is sometimes present. Glossitis means inflammation of the tongue. Patients may present with symmetrical paresthesia in the fingers and toes. Symmetrical means the same on both sides of the body. Paresthesia are abnormal sensations, such as tingling or pins and needles. There may also be early loss of vibration sense. Vibration sense means the ability to feel vibrations. The symptoms can include progressive weakness and ataxia. Progressive means continuing to develop or becoming worse. Ataxia means difficulty with balance and coordinated movement. Finally, the spleen may be palpable. Palpable means that it can be felt with the hand during examination. Review the language notes in the box. Onset means beginning. Insidious means slowly developing. Pallor means lack of color. Mild means slight. Jaundice means bilirubinemia. Breakdown means division into smaller parts. Bone marrow is soft tissue in bones. Symmetrical means both sides are the same. Vibration sense is the ability to feel vibrations. Progressive means continuing to develop. And palpable means can be felt with the hand. These simple definitions help you read and write medical case descriptions more accurately. We now move to page 39. Exercise 15.1 asks you to find words in the box with opposite meanings. The question and Arabic translation are on screen. The opposite of adequate is inadequate. The opposite of unlikely is likely. The opposite of mild is severe. The opposite of common is rare. The opposite of insidious is sudden. The opposite of for is against. These pairs are especially useful in clinical discussion. For example, a diagnosis may be likely or unlikely. Evidence may be for or against it. A disease may be common or rare. And symptoms may be mild or severe. Exercise 15.2 asks you to make word combinations using a word from each box. The correct combinations are bone marrow, differential diagnosis, insidious onset, iron deficiency, pernicious anemia, progressively increasing, and vibration sense. Learn each pair as one unit. Bone marrow is the soft tissue inside bones. Differential diagnosis is the list of possible explanations. Insidious onset means a slowly developing beginning. Iron deficiency means not having enough iron. The other combinations also appear in the text on page 38. Read the English instruction and its Arabic translation before checking each answer. Exercise 15.3. Complete the sentences. I will read each sentence once. The Arabic translation and the completed answer remain on screen. Number 1. A 39-year-old man presented with a history of blank abdominal distension over a period of 6 months. The answer is progressively increasing. Number 2. Blindness may be caused by vitamin A blank. The answer is deficiency. Number 3. The bleeding and purpura are caused by abnormal blank function. The answer is platelet. Number 4. The full blood count is normal, so we can blank acute leukemia. The answer is exclude. Number 5. The yellow color of her skin and conjunctivae is probably due to blank. The answer is bilirubinemia. Number 6. There was a blank mass in the right upper quadrant of the abdomen. The answer is palpable. Number 7. Treatment is aimed at restoring fluid balance with blank intravenous fluids. The answer is adequate. Number 8. The anemia may be due to increased red cell blank. The answer is destruction. Read each completed sentence and its Arabic translation on screen once more after the pause.
Exercise 15.4 asks you to complete the conversation. The professor asks, what is against the diagnosis of pernicious anemia on physical examination? The Arabic translation is displayed while the question is read. The student answers that the problem started suddenly, so it did not have the typical insidious onset. The patient does not have skin pallor. He does not have symmetrical paresthesia or absent vibration sense, and the student could not feel his spleen. The professor asks, what about his tongue? This question is also translated on screen. The student says that the tongue was normal and not inflamed or red. The answers are insidious, pallor, symmetrical, vibration, and red. In the Over to You task, list the causes of anemia mentioned in the conversation in section B. These include bleeding, excessive destruction of red cells, low production caused by iron deficiency, leukemia, aplastic anemia, chronic bleeding ulcer, and pernicious anemia. Then choose another medical condition that you encounter regularly and make a similar list of possible causes in English. This completes lesson 9. Review the Arabic translations and practice saying the English medical expressions slowly and clearly.